I'm going to explain why Trump had 22 doctors, and I'm going to show you how many Biden had by the end of his presidency for a comparison. The reason we're even talking about this is because a few days ago, the Washington Post released this article, and the internet is absolutely buzzing about a health cover-up or conspiracy. Check this out.
A massive medical bombshell about the oldest president ever. He was seen by 22 medical specialists, and the White House won't say who, and they won't say why, and they won't say what the findings were.
It is not looking good for Donald Trump as his physical and cognitive health continues to collapse rapidly before our eyes. Now we learn that Donald Trump saw 22 medical specialists during his semi-annual physical that he took in late May.
We are now getting leaked information through the Washington Post about what really went on in that checkup. We're learning that it's an unprecedented situation where the doctors are so concerned with Trump that there are literally dozens of them checking him out in just one day.
I've been an internal medicine and geriatrics specialist for 18 years, treating patients just like the president. Over a week ago, I released a full video analyzing Trump's annual physical, and I already briefly explained the reasoning for the 22 providers, but clearly there are still many people who don't understand what's going on. So let's go into a little more detail. How could there be 22 specialty providers? First, that doesn't necessarily mean all 22 are medical doctors. It also doesn't mean that all 22 of these providers personally examine the president. So let's look at who these 22 specialty providers probably were. So you've got your White House doctors, Captain Sean Barbabella. He's the physician to the president. And you also have Colonel James Jones. He's a PA, PhD. And there's probably 2 or 3 other White House medical unit physicians that are on staff, maybe more. Trump, as we all know, has swelling of the ankles, so he certainly has a vascular surgeon on his case, probably at least 2. He would also have cardiologists, at least 2, maybe an interventional cardiologist, and probably a nephrologist as well, which is a kidney doctor. You'll remember he had a CT scan, MRI, but it was a CT angiogram, so there would be a radiologist. There might also be an interventional radiologist and or a cardiothoracic radiologist. And speaking of radiologists, Trump had an ultrasound of the carotid arteries, so there probably was an ultrasound specialist radiologist as well. We know about the bruising on his hands, so he probably saw at least 1 or 2 hematologists. That's a blood doctor. He certainly would have seen an eye doctor, either an ophthalmologist or an optometrist. He was scheduled to see a dentist as well. Of course, he has his dentist that he sees down near Mar-a-Lago, and then also some dentists either at the White House or at Walter Reed. He probably also saw a prosthodontist, which is like a cosmetic dentist, maybe even an oral surgeon. He possibly also had a cognitive neurologist or some other sort of behavioral specialist to administer that MoCA test, the cognitive assessment test, although really a neurologist doesn't need to administer that test. It's fairly easy to do. We know that the president has hearing problems, so he probably saw an audiologist and or an otolaryngologist. That's an ENT doctor, ear, nose, and throat. We know the president has precancerous lesions and rosacea, so I'm sure he saw at least 1 dermatologist, probably 2. We know that he has diverticulosis, so I would imagine they consulted with a gastroenterologist. I'm pretty sure the president has either knee and or hip pain and probably some other musculoskeletal pain, so he's certainly seeing a physical therapist, probably 2 or 3 of those involved in the case over time, possibly a physiatrist and or a sports medicine doctor, maybe even an orthopedic surgeon. Trump has had blood work done, so there would be a clinical lab doctor or a medical director. There might also be a pathologist or a hematologist to help to interpret that blood work as well. He might have seen a urologist for any unreported erectile dysfunction problems. He does have travel doctors. Probably there's at least 2, maybe more of those. And he very likely has clinical pharmacists on his case as well. Probably at least 1 or 2 of those. So just with that list that I've given you there, that's something like 25 providers, just with what I've mentioned. And there certainly could be others that I haven't thought of or that we don't know about. The reason that so many consulting specialists, the reason for 22 doctors on the case, is because the White House doctor is practicing something called defensive medicine, or you might call it overly cautious medicine. And several of the critical specialists like cardiology and radiology are probably also practicing defensive medicine. There are 2 primary reasons that these doctors are practicing defensive medicine. Number 1, the President of the United States is the highest stakes patient on the planet. The entire press is scrutinizing the medical care closely, so the doctors will be overly cautious and thorough, knowing that everybody is going to be reading into their care. The number 2 reason they're practicing this defensive medicine is the patient himself, Donald Trump, who loves to sue people or to ruin people's lives. These doctors certainly don't want to mess up. They will practice defensive medicine. So by involving numerous specialists, it spreads the risk or the liability should a medical error be made or if some sort of medical diagnosis gets missed. And the more medical providers involved, it's less likely that an error will occur or that something will be missed. Let's compare Trump's 22 providers to other presidents, and it's important to understand that this number of providers involved in the care is not unusual for executive-level medical care. In the Washington Post article, they mentioned that George Bush, the dad, saw 5 specialists in 1989. George W. Bush, who was quite healthy, saw 12 medical providers. And we also know that Biden had 20 medical providers on his case. I'm going to read from his 2024 annual examination. But first, my mother-in-law recently reached Medicare age and she needed to pick a plan. She asked me, which plan should I pick? Well, I'm not a Medicare expert and I have no idea about all of the options available to her. So I told her to call my partner, Chapter. In less than 20 minutes, Chapter walked her through all of her Medicare options, original Medicare, supplemental plans, Advantage plans, and Part D, so she could find a plan that actually fit her doctors, her prescriptions, and her budget. So I invite you to call 504-613-5925 and speak with a trusted, unbiased Medicare advisor today, like my mother-in-law did. True story. I'm going to read from his 2024 annual examination, which was a much more thorough report than Trump's, by the way. Here's what it says. These specialties have included optometry, dentistry, orthopedics, foot and ankle, orthopedic spine, physical therapy, neurology, sleep medicine, cardiology, radiology, and dermatology. Each of these specialists have independently reviewed the chart, examined the president, and concur with my findings and recommendations. I have also solicited feedback from my respected colleagues, the other physicians in the White House medical unit who see the patient every day. Each of these doctors has reviewed my report for accuracy. My conclusions have been further informed through discussions with several of my fellow professors from George Washington University School of Medicine. So you can see for this executive level medical care, it's routine to involve many specialists, either directly or indirectly. There is no conspiracy here, but I'll tell you what is missing: a psychiatric evaluation. Trump's most dangerous problem is a severe psychiatric disorder. You can learn more about that psychiatric disorder in this video that we published recently. One other point that I want to make about this. We are taking our eye off the ball. We are losing focus on what's important. Trump isn't going anywhere. He won't be removed from office. These independent media commentators have tens of millions of followers across platforms. They're major media players in the political attention economy. They collectively have as much political influence as major media sources like CNN. And here we are talking about things that will have no material impact on the lives of average Americans, like Trump's 22 doctors. I'll give you one example of something they could be talking about. There's a very important election for Senate coming up this November in Maine. And as the Maine Monitor reports, one of the candidates, GOP incumbent Susan Collins, has taken donations from nearly 100 billionaires to help her win re-election. That is an insane number. Susan Collins is literally bought by billionaires and will serve at the pleasure of billionaires if she is reelected. These are the catastrophes we cannot allow to happen, and it is what we should be talking about. We should be focusing on the November elections. We should be elevating candidates that are not bought by the billionaire ruling class. We need to focus on election integrity, and we need to be making a plan to reverse the damage Trump has done to this country and pass laws to prevent future tyrants from doing the same thing Trump has done. Leave a comment. Let me know what you think is the most important current issue we should be focusing on. We have more videos coming soon. One is about Trump's health, what's fact and what's fiction, and another is about a common manipulation tactic that Trump is using to keep us in the Iran war, and it's related to his psychiatric disorder. Please subscribe and be sure to hit the bell icon so those videos find you when we drop them. Thank you very much to our valued members. Come say hi to me. I'm over on Blue Sky. Take care. I'll see you soon.